So when I first met Jamie, he had come into my office back in the fall with increasing hip pain. He had been in a motorcycle accident around 9 years ago and had broken his femur, pretty substantially. It had multiple surgeries on it at that time. He ended up healing well, but ended up developing arthritis and some avascular necrosis or bony complications of his prior surgeries and required a hip replacement surgery.
Jamie loves the outdoors. He loves fishing. So to have his mobility be questioned and whether or not he'd be able to be mobile for the rest of his life was a big concern for us.
After meeting with Jamie a few times, we discussed our options and we both decided that advanced technology would be able to really help him get back to his desired level of activity and lifestyle.
When we were referred to Dr. Musto at Parrish, he took the time to explain the procedure, actually showed us what it would look like, and just the fact that we knew we would have less chance of errors, that's very important.
One of the major benefits of the VELYS robotics assisted solution is that there's a limited radiation exposure for the patient, so we don't have to use expensive CT scans or scans that add additional radiation exposure to the patient, and we can acquire all the data we need during the procedure. I think every patient has place to benefit from increased precision and advanced technology in joint replacement surgery. It just helps us accomplish a goal that we have for that patient in a much more reliable and reproducible way.
He's getting his life back, he's getting his mobility back, he sleeps great at night, which helps me sleep great at night, so we're both excited about that.
He did very well. He was able to discharge home the same day. He was up walking, and I think he even made it back to his retirement party a few weeks later, so he's very excited about that.
I feel great. No pain in my hip anymore. I'm getting ready to get out, start playing the sports that I used to play that I haven't played months and months because of the pain. So if you need your hips replaced, definitely go with the VELYS system and get rid of that margin of error that's possible.
One of the more exciting parts of using advanced technologies is, what the future is going to hold. This is going to unlock a whole new data set and help us rethink the way that we do joint replacement surgery, and we're just kind of scratching the surface for where we're going to be in the future.